In this section, we'll look at the bones of the facial skeleton and the part of the skull the facial skeleton is attached to, the base of the cranium. Understanding the bony anatomy of this region will give us a good foundation for understanding some large and important areas of the head and neck. We'll begin by taking an all-around look at the main bony features of the region. Then we'll look at the individual named bones that make up the facial skeleton and the base of the cranium. Lastly, we'll look at the openings in the base of the cranium which some important nerves and blood vessels pass through. The facial skeleton consists of a number of named bones. We'll look at them individually later in this section, but we'll start by looking at the main overall features of the facial skeleton. To simplify the picture, we'll remove the mandible. The cavity for the eye is called the orbital cavity. It's protected on the outside by the thickened orbital margin. The opening for the nose leads to the right and left nasal cavities, which are separated by the nasal septum. The upper jaw, or maxilla, bears the upper teeth. The prominence of the cheekbone leads back to this bony arch, the zygomatic arch. The deepening hollow here is the temporal fossa. It's enclosed by this ridge, the temporal line, by the lateral orbital margin, and by the zygomatic arch. The temporal fossa contains the large temporalis muscle. The temporal fossa is continuous with this deeper hollow, the infratemporal fossa. The walls of the infratemporal fossa are formed by this part of the base of the skull and by the posterior part of the maxilla. The infratemporal fossa contains the pterygoid muscles and also this part of the mandible, the coronoid process. On the underside of the skull, we come to structures that we've seen already. Here's the foramen magnum, the basilar part of the occipital bone, and the petrous part of the temporal bone. Two thin sheets of bone project down from the base of the skull behind the maxilla. They're the pterygoid plates, lateral and medial. Between the two medial pterygoid plates are the posterior openings of the nasal cavities, the posterior nares, or choanae. The hard palate forms the roof of the mouth and the floor of the nasal cavities. Here inside the nasal cavities are the conchae, or turbinate bones. We'll look inside the nasal cavity in the next section. The posterior nares open into the nasopharynx, which lies in the space between the medial pterygoid plates, the base of the occiput, and the anterior arch of the atlas vertebra. In a minute, we'll look at the individual named bones that form the facial skeleton. Before we do that, we need to take a look at some of the features of the inside of the skull. This special skull has been cut away at a series of levels that are just above the floor of the cranium. The way it's been cut reflects the fact that there are two big steps in the floor of the cranium, formed by the sphenoid ridges and the petrous temporal bones. These divide the floor of the cranial cavity into three parts: the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. We saw the posterior cranial fossa in the previous section. In this section, we'll look at the main features of the anterior and middle cranial fossae. The bone that forms this upward bulge in the floor of the anterior fossa is the same bone that forms the roof of the orbit. This crest in the midline is called the crista galli. On either side of it is a depression, the base of which is formed by these small areas of thin perforated bone, the cribriform plates. The cribriform plate forms the very narrow roof of the nasal cavity. Here we can see it from below. The filaments of the olfactory nerve, which transmits the sense of smell, pass through the openings in the cribriform plate. This flat area behind the cribriform plates is the roof of a cavity that we'll see later, the sphenoid sinus. Now we'll move back to the middle cranial fossa. The bone that forms the side wall and floor of the middle cranial fossa also forms, on the outside of the skull, the wall of the temporal fossa and of the infratemporal fossa. We've seen that this is the roof of the orbit. The bone that forms the anterior wall of the middle temporal fossa also forms part of the orbit. It forms this posterior part of the lateral orbital wall. This complicated raised area in the middle is called the sella turcica. The main features of the sella turcica are this deep depression, the pituitary fossa for the pituitary gland, this shallow groove for the two optic nerves, and these four projections, the anterior and posterior clinoid processes. This sloping surface behind the posterior clinoid processes, the dorsum celli, is continuous with the base of the occiput. The floor of the middle cranial fossa is marked by numerous openings for nerves and blood vessels, which we'll come back to later in this section. Now that we've looked at the shape of the facial skeleton and the parts of the cranium that it's attached to, let's look at the individual facial bones and see how each of them contributes to the features that we've seen. We'll look at the 5 largest facial bones first. There are the frontal and zygomatic bones, the maxilla, the sphenoid bone, and the ethmoid bone. The frontal bone is a very large bone. The lower part of the frontal bone forms the beginning of the root of the nose, the upper part of the orbital margin, a small part of the temporal fossa, and a large part of the roof of the orbit. The frontal bone also forms most of the floor of the anterior cranial fossa. The part of the frontal bone near the midline is hollow. The hollow space is the frontal sinus, one of the paranasal sinuses, which we'll look at shortly. Next, we'll look at the zygomatic bone. The zygomatic bone forms the bony prominence of the cheek. It also forms the lower lateral part of the orbital margin and this part of the lateral orbital wall. The zygomatic bone extends backward to meet the zygomatic process of the temporal bone, forming the zygomatic arch. Now we'll move forward and look at the maxilla. Here's the maxilla. The right and left maxillae are joined together in the midline. On each side, the maxilla forms the lower medial part of the orbital margin and almost all of the floor of the orbit. The maxilla bears the upper teeth. On the underside, it forms much of the hard palate. The maxilla is hollow. It contains the largest of the paranasal sinuses, the maxillary sinus. To see the posterior part of the maxilla, we'll remove the zygomatic arch. Here's the back of the hollow part of the maxilla. Down here, the maxilla is joined to the bone behind it, the sphenoid bone. Apart from this attachment, the maxilla is separated from the sphenoid by this impressive cleft, which has a vertical part and a horizontal part. The vertical part of the cleft is called the pterygomaxillary fissure. The horizontal part of the cleft is called the inferior orbital fissure. The inferior orbital fissure, here it is from in front, separates the floor of the orbit, formed by the maxilla, from the lateral wall that's formed by the sphenoid. Now we'll move on to look at the sphenoid bone. The sphenoid bone is extremely complex. It extends all the way from one side of the skull to the other. The sphenoid bone forms important parts of the underside and outside of the skull, and it forms part of the orbit. The sphenoid bone also forms this large and complicated part of the floor of the cranium. Here's a sphenoid bone all by itself. The sphenoid bone has a central part, and on each side 3 major projections: the lesser wing, the greater wing, and the pterygoid process. The central part of the sphenoid includes the clinoid processes and the pituitary fossa. The central part of the sphenoid bone is hollow, as we'll see. The lesser wing, which is the highest part of the sphenoid bone, forms the sphenoid ridge, which separates the anterior and middle cranial fossae. The underside of the lesser wing forms this small but important part of the back of the orbit. The greater wing of the sphenoid forms the front wall and part of the floor of the middle cranial fossa. On the outside, the greater wing forms this part of the temporal and infratemporal fossae, and it also forms this large part of the lateral wall of the orbit. The greater wing and the lesser wing are joined here, but more medially they're separated by this triangular gap, the superior orbital fissure, which forms a large opening between the orbit and the inside of the cranium. Here's the superior orbital fissure from the inside. We'll get a better look at it in a minute. The pterygoid process of the sphenoid bone projects downward behind the maxilla. The pterygoid process includes the lateral and medial pterygoid plates, which are the attachments for some important muscles that we'll see later. This hollow between the pterygoid plates is the pterygoid fossa. This little hook is the pterygoid hamulus. It's a pulley, as we'll see later. The last bone on our list of large facial bones is another quite complicated bone, the ethmoid. The ethmoid bone is a little hard to understand at first because in the intact skull, most of it is hidden from view. The only parts of the ethmoid bone that we can readily see are this small part of the floor of the anterior cranial fossa, the 2 cribriform plates with the crista galli in between, and this part in the medial wall of each orbit. It'll be easier to understand the ethmoid bone when we look at the nasal cavity in the next section. Till then, we'll leave the ethmoid bone alone. There are 3 smaller facial bones that we'll look at briefly: the nasal, lacrimal, and palatine bones. This is the nasal bone. This is the lacrimal bone. The 2 thin nasal bones form just the upper part of the bridge of the nose. The structural supports for the projecting parts of the nose are made of cartilage, as we'll see later. The little lacrimal bone forms the most medial part of the inferior orbital margin. This opening between the lacrimal bone and the ethmoid bone is for the nasolacrimal duct, which takes tears from the corner of the eye to the nasal cavity. Last of all, we'll look at the palatine bone. Here's the lower part of it. On each side, the palatine bone forms the posterior part of the hard palate and part of the side wall of the nasal cavity. We'll get a better look at the palatine bone when we look at the nasal cavity. Now we'll move on to take a look at the openings in the floor of the anterior and middle cranial fossa that we saw earlier. We'll look at 3 openings that pass forwards, 2 openings that pass downwards, and 1 that, in spite of appearances, passes obliquely backwards. We'll start with the ones that pass forwards. This round opening just in front of the anterior clinoid process is the optic canal for the optic nerve. Lateral to it, this large triangular opening is the superior orbital fissure, which we've seen already. Numerous nerves and blood vessels pass through it into the orbit. Below and behind the medial end of the superior orbital fissure, this smaller round opening, the foramen rotundum, is for the maxillary branch of the trigeminal nerve. We'll put this pointer in the foramen rotundum and go round to the outside. Here's the superior orbital fissure again. Here, medial to it, is the optic canal. The foramen rotundum emerges not into the orbit, but into the pterygomaxillary fissure. The 2 openings that pass downward are the foramen ovale for the mandibular branch of the trigeminal nerve, and just behind and lateral to it, the foramen spinosum for the middle meningeal artery. To see where those 2 come out, we'll go round to the underside. Here's the foramen ovale, just behind the lateral pterygoid plate. Here's the foramen spinosum, just behind and lateral to the foramen ovale. The last opening to look at is this untidy-looking opening, the foramen lacerum, for the internal carotid artery. In a dry skull, the appearance of the foramen lacerum is quite misleading. It appears to pass straight down through the base of the skull, emerging here at the tip of the petrous temporal bone. In the living body, the apparent opening on the underside is filled in with dense cartilage and fibrous tissue, represented by this material. Fibrous tissue also fills in this ragged part of the internal bony opening. What's left of the foramen lacerum is a clean-cut opening through which the internal carotid artery emerges from its obliquely running bony tunnel, the carotid canal. The other end of the carotid canal, as we saw in the previous section, is back here, just medial to the styloid process. In front of the opening for the carotid canal, there's one further opening that we haven't seen yet, the opening for the auditory tube, also called the eustachian tube. The auditory tube passes backwards and laterally to emerge here in the middle ear. The auditory tube is longer than this. Medially, it's prolonged by a tube of cartilage, represented by this colored material. The auditory tube opens into the nasopharynx, as we'll see. We'll look at these openings again in the sections of these 2 tapes that deal with the blood vessels and cranial nerves. We've seen a lot of bony anatomy in this section. Let's review what we've seen of the anatomy of the facial bones and the base of the cranium. Here's the frontal bone, the zygomatic bone, the maxilla, the sphenoid bone, and the ethmoid bone. Here's the nasal bone, the lacrimal bone, and the palatine bone. Here's the orbital cavity, the orbital margin, and the opening for the nasolacrimal duct. Here's the zygomatic arch, the temporal line, the temporal fossa, and the infratemporal fossa. Here's the pterygomaxillary fissure and the inferior orbital fissure. On the sphenoid bone, here's the lesser wing, the greater wing, and the pterygoid plates, medial and lateral. Here's the pterygoid fossa here's the hamulus. On the inside, here's the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. Here's the sphenoid ridge, the crista galli, and the cribriform plates. Here's the sella turcica, consisting of the anterior and posterior clinoid processes, the pituitary fossa, and the dorsum celli. Here's the optic canal, the superior orbital fissure, and the foramen rotundum. Here's the foramen ovale, the foramen spinosum, and the foramen lacerum. Here's the true opening of the carotid canal. Here's the opening for the auditory tube. Here's the cartilage of the auditory tube. That brings us to the end of this section on the bony anatomy of the facial skeleton and the base of the skull. In the next section, we'll move on to look at the upper part of the air passage. You'll recall that there's one important bone that we haven't yet understood, the ethmoid bone. We'll take a good look at it in the next section. In the next 3 sections, we'll look at the parts of the head and neck that are involved in 2 vital functions: breathing and eating and drinking. To get a preview of these major topics, we'll look at a specimen that's been divided in the midline. The passage for air and the passage for food and liquid begin separately at the nose and the mouth. Air passes backward through the nasal cavity and the nasopharynx. Food and liquid pass backward through the oral cavity. The 2 passages unite here. Air, food, and liquid all pass through this common passage, the oropharynx. The 2 passages separate again here, in the hypopharynx. Food and liquid pass backward into the esophagus on their way to the stomach. Air passes forward through the larynx and into the trachea on its way to the lungs. So, the lines of travel for air and for food and liquid cross over in the oropharynx. It's important that air on the one hand and food and liquid on the other hand don't pass upward or downward into the wrong passage. To take care of this, there are important mobile structures above and below the oropharynx that act as separators. These are the soft palate above and the epiglottis and vocal cords below. As we'll see in later sections of this tape, the structures that form the passages for air and for food and liquid are also involved in a further important function, the production of voice sounds. In this section, we'll look at the upper part of the air passage. We'll look at the external nose, the nasal cavities, the paranasal sinuses, and the nasopharynx. We'll start by looking at the bony structures that surround these spaces. The bony opening for the nose is called the piriform aperture. Inside it, there are 2 nasal cavities, a right and a left, separated in the midline by the nasal septum. To get a better look inside, we'll divide the skull in the frontal plane along this line. There's a lot to see here. Let's get ourselves oriented. Here's the hard palate. Here's the floor of the anterior cranial fossa. Here are the medial walls of the orbits. Here are the 2 nasal cavities. The septum dividing them is a little off-center, which is not unusual. The roof of each cavity, formed by the cribriform plate, is very narrow. The medial wall of each nasal cavity, formed by the septum, is smooth and featureless. So is the floor. By contrast, the lateral wall is marked by a number of features, most notably by these 3 delicate bony projections, the conchae, also known as the turbinate bones. This is the inferior concha, this is the middle concha, This is the much smaller superior concha. The three conchae partially divide the air passage into three parts: the inferior meatus, the middle meatus, and the superior meatus. Here's the back of the orbital cavity. Below it is the hollow space in the maxilla, the maxillary antrum, which we'll look at later. At about the level of the floor of the orbit, the nasal cavity becomes much narrower. The narrowing is caused by the presence of this collection of small hollow spaces, the ethmoid air cells. We'll see more of these in a minute. To see more of the septum and the nasal cavity, we'll look at it in a skull that's been divided just to the left of the midline. Here's the bony part of the nasal septum. It's formed by this part of the ethmoid bone, the perpendicular plate, and by this small bone that we haven't encountered up till now, the vomer. The lowest part of the septum is formed by the maxilla and by the palatine bone. Here's the divided left cribriform plate. This projection above it is something we've seen before. It's the crista galli. The frontal section we were looking at was divided here, just behind the crista galli. Now we'll remove the septum to get a good look at the lateral wall of the nasal cavity. The roof of the nasal cavity runs along this line, rising to its highest point along the length of the cribriform plate. Here are the conchae again, superior, middle, and inferior. There are several openings in the lateral wall of the nasal cavity. They're partly hidden by the conchae. We'll see them in a minute. The lateral wall of the nasal cavity is formed partly by the maxilla, partly by the ethmoid bone, and partly by the perpendicular part of the palatine bone. Further back, where the nasal cavity becomes the nasopharynx, the lateral wall is formed by the medial pterygoid plate. The large facial bones that surround the nasal cavity, the frontal bone, the maxilla, the sphenoid, and ethmoid bones, are hollow to a greater or lesser extent. The hollow spaces in these bones contain the paranasal sinuses, which in the healthy living body are filled with air. The paranasal sinuses all communicate with the nasal cavity. To see the sinus cavities, we'll look at a skull in which part of the bone that overlies each sinus has been removed. Here's the cavity for the right frontal sinus. There's a left one, too, on the other side of this partition. The frontal sinus extends upward behind the lower part of the forehead and also, to a variable extent, backwards between the roof of the orbit and the floor of the anterior cranial fossa. Here's the cavity for the right maxillary sinus, also known as the maxillary antrum. It extends backwards to the part of the maxilla that borders the pterygomaxillary fissure. It extends downwards almost to the root of the upper molar and premolar teeth. The medial wall of the maxillary sinus is also the lateral wall of the nasal cavity. Its roof forms a large part of the floor of the orbit. The sphenoid sinuses occupy the central part of the sphenoid bone. This opening has been made to show the right sphenoid sinus. To see it better, we'll look at the skull divided in the midline. Here's the right sphenoid sinus again. Above the sphenoid sinus is the floor of the anterior cranial fossa and the sella turcica. Behind it is the basilar part of the occipital bone. In front of it is the high part of the nasal cavity. Below it is the roof of the nasopharynx. Lastly, we'll come round to the front to look at the collection of small cavities that contain the ethmoid air cells, collectively referred to as the ethmoid sinus. These extend from just behind the nasolacrimal duct all the way back along the medial wall of the orbit. As we've seen already, the ethmoid air cells lie between the medial wall of the orbit and the lateral wall of the upper part of the nasal cavity. Before we go further, we need to catch up on something that we left unfinished in the previous section, understanding the ethmoid bone. We've encountered the various parts of the ethmoid bone, but till now we've put off seeing the whole of it. We'll do that now. Then we'll come back and look at the openings of the paranasal sinuses. The ethmoid bone is a fragile coalition of parts. The best way to see all of them is to go back to the skull that was divided in the frontal plane. All of this is the ethmoid bone. This part, the perpendicular plate of the ethmoid, forms a large part of the bony nasal septum. This upward projection is the beginning of the crista galli, which rises up in the floor of the anterior cranial fossa. On each side of the crista galli are the cribriform plates, which we've seen already from above and from below. The most lateral part of the ethmoid bone is this paper-thin layer, the lamina papyracea, which forms this part of the medial wall of the orbit. Between the lamina papyracea and the upper part of the nasal cavity are the ethmoid air cells, as we've seen. The superior and middle conchae are also parts of the ethmoid bone. The ethmoid bone is joined to the frontal bone above, the maxillae below, and the central part of the sphenoid bone behind. Now that we've seen the ethmoid bone, we'll return to the cavities for the paranasal sinuses and see how they connect with the nasal cavity. We'll look at the openings for the frontal and maxillary sinuses first. Here's the frontal sinus cavity. Here's the maxillary sinus cavity, seen through an artificial opening. The frontal and maxillary sinuses both open in this complex area beneath the middle concha, which we need to look at in more detail. In a dry skull, there are two large irregular openings from the nasal cavity into the maxillary sinus, separated by this flake of bone, the uncinate process. In the living body, all of this opening and much of this one are closed off by soft tissue. The real opening of the maxillary sinus is back here. If we look in from in front, we can see that the opening is quite high on the medial wall of the maxillary antrum. The frontal sinus opens into the nasal cavity by way of a narrow passage, the frontonasal duct. The frontonasal duct starts above the uncinate process and runs upward and forward to reach the frontal sinus. The frontal and maxillary sinuses open into the nasal cavity, not directly, but into a narrow side chamber located here, called the infundibulum. The infundibulum isn't apparent in a bony specimen. We'll see it when we look at the soft tissues. Now we'll look at the openings for the other sinuses. The sphenoid sinus opens into the nasal cavity here, above and behind the superior concha. The ethmoid air cells, which are up in this region, have several small openings into the nasal cavity. Some of these are behind the middle concha, some of them are below it. There are two more openings to see in the lateral wall of the nasal cavity. The opening for the nasolacrimal duct, or tear duct, and an opening for nerves and blood vessels, the sphenopalatine foramen. As we've seen, the bony passage for the nasolacrimal duct starts here. The nasolacrimal duct, which is quite short, passes downwards and backwards to open beneath the inferior concha. Here's its opening. The last opening to look at, the sphenopalatine foramen, is the inner end of a short tunnel for blood vessels and nerves to the nose and palate. On the inside, it opens near the back of the superior meatus. We'll go all the way round to the outside to see the other end of the sphenopalatine foramen, which is here. in the depths of the pterygomaxillary fissure. Now that we've seen the bony features of the nasal cavity, we'll move back and look at the bones that surround the nasopharynx. Here's the posterior opening of the nasal cavity, the choana, or posterior nares. Its lateral wall is formed by the medial pterygoid plate. The medial pterygoid plate ends below in the hamulus. This piece of colored material represents the cartilage of the auditory tube. The cartilage forms an incomplete tube, open on the underside. Close to the medial end of the cartilage is a group of openings in the base of the cranium that we've seen before from a different angle: the foramen ovale, foramen spinosum, the opening of the carotid canal, and the jugular foramen. The roof of the nasopharynx, formed by the underside of the sphenoid and the basal part of the occipital bone, slopes downward toward the foramen magnum. To complete our picture of the bones around the nasopharynx, we'll add the cervical vertebrae. Here's the anterior arch of the atlas, and here's the odontoid process of the axis. Now, let's review what we've seen of the bony structures that surround the upper part of the air passage. Here's the piriform aperture and the nasal septum. Here are the posterior nares, or choanae. Here's the inferior concha, the middle concha, and the superior concha. Here are the superior meatus, middle meatus, and inferior meatus. Here's the cavity for the frontal sinus, the maxillary sinus, the sphenoid sinus, and here are the ethmoid air cells. Here are the cribriform plates, the uncinate process, and the vomer. Here are the frontonasal duct, the openings for the maxillary sinus, the sphenoid sinus, and the ethmoid air cells, posterior and anterior. Here are the openings for the nasolacrimal duct and the sphenopalatine foramen. Now that we've looked at the bony features of the nasal cavity, the paranasal sinuses, and the nasopharynx, let's see what this region looks like in the living body. We'll start with the entry to the air passage that forms such a distinctive feature of the face, the external nose. The skin over the upper, bony part of the nasal framework is thin and mobile. The skin over the lower, cartilaginous part is thicker and fixed to the underlying structures. The openings which form the beginning of the air passage are the nostrils, also called the anterior nares. We'll remove the skin from one half of the nose so that we can see the underlying structures. The edge of the bony opening for the nose, the piriform aperture, is here. Here's the nasal bone. The two nasal bones, united in the midline, form the bridge of the nose down to here. From here, almost to the tip, the bridge of the nose is formed by the front edge of the septal cartilage, which we'll see more fully in a minute. On each side, the framework of the nose is formed by two slender pieces of cartilage, the lateral cartilage and the alar cartilage. The lateral cartilage is thin and flat. In front, it's continuous with the septal cartilage. The alar cartilage has two parts, the lateral crus and the medial crus. The lateral crus forms the curved outer framework of the nostril. The medial crus turns sharply backwards, ending here. Together, the two medial crura form the framework of the lowest, most anterior part of the nasal septum, which is called the columella. To get a good look at the nasal septum, we'll divide the bone and soft tissues along this line and remove the left side of the face. Here's the nasal septum. Before we look at it, let's get oriented. Here's the anterior cranial fossa. Here's the bony palate, or hard palate, with the soft palate extending behind it. Here's the oral cavity. Here's the opening of the right nasal cavity. Behind it is the nasopharynx, which we'll look at in a minute. The nasal septum extends from here behind to here in front. This small part of the septum is covered with skin. The rest of it is covered with this layer of mucous membrane. We'll remove a small piece of the mucous membrane so that we can appreciate its thickness. The highest part of the septum is the specialized olfactory area. It contains some of the fibers and nerve endings of the olfactory nerve, which are the sensory receptors for our sense of smell. The cribriform plate, which the olfactory nerve fibers go through, is at this level. Now we'll remove all the mucous membrane from the septum so that we can see the underlying cartilage and bone. This part of the septum is bone, as we've already seen. This part is formed by the septal cartilage. In this specimen, there's an unusual defect in the cartilage here. In front, the septal cartilage forms the bridge of the nose down to here, then runs downward and backward to attach to this bony prominence on the maxilla, the anterior nasal spine. Now we'll remove the whole of the nasal septum so that we can see the lateral wall and floor of the nasal cavity. The inside of the nostril, up to the lower border of the lateral cartilage, which is here, is called the nasal vestibule. It's lined with skin. The rest of the nasal cavity is lined with mucous membrane. Here are the conchae, superior, middle, and inferior. The mucous membrane that covers them is richly supplied with mucus glands and with blood vessels. The complex surfaces of the conchae have important functions in humidifying the inspired air and warming it. This olfactory area, like the corresponding area on the septum, contains olfactory nerve fibers and nerve endings. All the paranasal sinuses and the nasolacrimal duct for the tears open into the nasal cavity. To see their openings into the nasal cavity, we'll remove the conchae. The inferior concha was here. Here beneath it is the opening for the nasolacrimal duct. Beneath the middle concha, which was here, is a deep groove called the semilunar hiatus. To see where this leads, we'll retract its lower border with this thread. The semilunar hiatus leads into a narrow, irregular side chamber called the infundibulum. The infundibulum receives the openings of the frontal sinus and the maxillary sinus. Sometimes the more anterior ethmoid air cells open into the infundibulum too. Sometimes, as in this case, they open separately, below the middle concha. Here's where the superior concha was. The more posterior ethmoid air cells open below the superior concha. The sphenoid sinus, which is this cavity, opens forwards into the highest part of the nasal cavity, the sphenoethmoidal recess. Here's the frontal sinus cavity in a different specimen. The opening to the frontonasal duct is behind here. To see the other sinus cavities, we'll take a look from the outside at a dissection in which all the facial soft tissues have been removed. Here's the maxillary sinus cavity, opened from in front. The opening from the sinus into the infundibulum is all the way up here on the medial wall. Here are the ethmoid air cells, with the lamina papyracea removed. This opening in the medial wall of the orbit also exposes the infundibulum. Now we'll move back and look at the nasopharynx. To do that, we'll put the nasal septum back in place. Here's the right half of the nasopharynx. The openings from the two nasal cavities into the nasopharynx, here's the right one, are called the choanae, or posterior nares. The roof of the nasopharynx lies underneath the basilar part of the occipital bone. The back of the nasopharynx lies in front of the atlas vertebra. Here's the anterior arch of the atlas. In the mucosa of the lateral wall of the nasopharynx, there's a pronounced inward fold called the torus tubarius. It's produced by the inward projection of the cartilage of the auditory tube. The mucosal opening of the tube is here. Behind the torus tubarius is a deep recess, the pharyngeal recess. The floor of the nasopharynx is formed by the soft palate, which forms a highly mobile partition between the nasopharynx and the back of the oral cavity. The nasopharynx opens downward into the oropharynx. The soft palate can move upwards, backwards, and downwards. Its movements, which are important in swallowing and in speech, are produced by several small muscles. These converge on the soft palate from above and from below. Most of them insert on a sheet of aponeurosis, or tendon-like material, that occupies this part of the palate. In this section, we'll see only the palatal muscles that come from above. We'll see the ones that come from below in the next section. The two that we'll see now are the levator palati and the tensor palati. To see these muscles, we'll remove the mucosa of the nasopharynx. Here's the end of the cartilage of the auditory tube. Here below it is the levator palati muscle. Its full name is the levator veli palatini. Levator palati arises here on the petrous temporal bone. It passes along the underside of the auditory tube, runs downward and medially, and joins in the midline with its fellow from the other side, forming a sling. Levator palati moves the soft palate upwards and backwards. To see the tensor palati muscle, we'll remove the levator. Here's tensor palati. Tensor palati arises from this area, just above the root of the medial pterygoid plate. Here's the edge of the medial pterygoid plate. The fibers of tensor palati pass downward and forward towards the pterygoid hamulus, which is here. The tendon of tensor palati makes a complete 90-degree turn round the pterygoid hamulus. Here's the tendon emerging. It passes medially to insert on the palatal aponeurosis. The action of tensor palati is to tighten the palate when the tongue presses up against it in the act of swallowing. It also may help to open the auditory tube. We'll end this section with a look at the auditory tube. Here's the end of the cartilage of the auditory tube. The cartilage doesn't form a complete tube. It's open on the underside. Here's the cut edge of the mucous membrane, which forms the real auditory tube. It passes backwards and laterally to reach the cavity of the middle ear. The function of the auditory tube is to keep the pressure inside the middle ear the same as the pressure outside it. Now, let's review what we've seen of the upper part of the air passage. Here are the nostrils, or anterior nares, the columella, the lateral cartilage, the alar cartilage, the septal cartilage, the nasal vestibule, and the olfactory area. Here are the conchae again, superior, middle, and inferior. Here's the nasopharynx, with the torus tubarius, the pharyngeal recess, and the soft palate. Here's the semilunar hiatus and the infundibulum. Here's the levator palati, the tensor palati, and the cartilage of the auditory tube. That brings us to the end of this